Hola, bienvenidos al episodio número 30 de la séptima temporada de Abiertamente Conversaciones con Yoga al Alma. Hoy tengo una invitada distinta. Esto para mí es un reto y es un reto que decido asumir con la paz que ella trae porque yo estoy como un huracán, porque mañana me voy para un retiro y ella llega con toda la paz que la persona que me la introdujo me prometió. Entonces les voy a contar un poco porque me gusta darles contexto. Ella se llama Dr. Rachael Coakley y es especialista en dolor. Esto es una cosa muy bonita, trabaja en el Boston Children's Hospital, ¿cierto? Llegó a través de Eli Peláez, de Growth, que ya estuvo acá hablándonos del aprendizaje, de la neurodivergencia, de cómo aprendemos, de cómo se presentan ahora estas inteligencias múltiples en los niños. Si no lo han escuchado, súper invitados a regresar a ese episodio. Y ahora me dirijo a hacer una entrevista en inglés que vamos a traducir para todos ustedes. Me interesa mucho que puedan tener todos sus sentidos en esto porque es algo que no hemos trabajado acá. Es una gran oportunidad y pues es un honor porque sé que es una mujer muy importante. Yo voy a pedir que sea ella la que nos cuente un poco sobre los títulos y no por el tema de biografía. Ustedes saben que eso no es lo que a mí me trasnocha, pero sobre dolor, sobre bienestar, sobre mindfulness, hay muchas personas hablando desde mi orilla, desde el yoga, desde el crecimiento personal. Pero cuando el mundo de la medicina, cuando el mundo de la psicología y cuando el mundo de la psiquiatría se acercan a estas herramientas y se acercan a la parte más humana que a veces confundimos con esa máquina a la que nos queremos acercar desde lo médico solamente, y nos avalan estas herramientas, entonces decimos, sí, parece que nuestro mundo está cambiando y se está acercando a un lugar donde todas esas teorías se encuentran en pro del ser humano, en pro de la sanación. Creo que esa es la oportunidad más linda que tendremos hoy y con la conversación se irá develando. Okay, now with you. Welcome.
Thank you so much for having me.
No, thank you for coming to my house. I'm very happy to be speaking to someone who has been coming from a very respected place, like in education, to speak about things that in my yoga world has been like every day, but didn't have like the permission to treat like serious illnesses and painful things that every human being has been passing through in their lives.
Of course.
So first I would like to know, what did you study and why? Why did you come to this point?
Thank you so much. And I first want to say that I agree with you that people don't understand this, and yet everybody experiences pain in life. Nobody gets through their life without having pain, and yet it's one of the most poorly understood parts of healthcare. So how I got to this place. As a young child, I actually had a seizure disorder. Generalized seizure disorder, had a lot of interactions with the healthcare system, saw the impact that that had on my family, and I grew up in a kind of rural area. Wasn't a lot of access to healthcare, and it wasn't pediatric focused for sure. So I remember a lot of scary engagements with the healthcare system, and I remember thinking, even at a young age, we can do better than this, right? Wow. Why should this be so scary and stressful for families, right? Thankfully, I grew out of all of that with these, they're called idiopathic seizures. You can outgrow them. But I became very interested in the crossroads between psychology, how we think and feel about the world around us, and our physical health and well-being. Wow. When I went to college, I studied at the University of Pennsylvania, and I majored in psychology there, but they had just started a new program there called the Biologic Basis of Human Behavior. It was a specialty, and it was because students in the 1980s really had pushed for really getting to the science behind this mind-body, or I call it the brain-body connection, because our brain is connected to our body. But for most of science, they have thought, no, what you think and feel is different from what you physically feel in your body, but it's not. And so I studied that crossroads in college. I went to graduate school and worked with a fabulous mentor in the field, Dr. Grayson Humbach, who was a pioneer in really studying resilience in kids that had chronic illness. And so my early research there was working with kids that had spina bifida, a condition that you're born with. And I really was interested in what makes some kids do really well in life with this condition and some kids really struggle. And what's interesting about spina bifida is that you're born with a lesion on your spine, and the higher up the lesion is, the more physical disability you have, right? So if the lesion is up by your neck or shoulders, you lose mobility in your arms and your legs and things like that. Where the lesion is when you have spina bifida does not predict how well you do. And this has been proven over and over again in health. Severity of illness, severity of disease is not a predictor of life satisfaction, of how good you feel about yourself, about mood, any of that. But we do know what those factors are. We do understand those factors. And I was really interested in kids about what makes them resilient. Resilience, I think of as bounce, right? Because we all face challenges in life, and having a chronic illness or a chronic painful condition is a challenge. Nobody would debate that. But some kids are bouncier than others. They hit this wall, they hit this challenge, and they have the skills to surpass it. And they go on to function really beautifully in their lives. And other kids really, really struggle. And so I wanted to understand the science behind that. And what we know is that these skills that make kids bounce are teachable. You can learn them.
Wow.
And so early in my career, I was working in oncology for my residency and for my fellowship, and working with kids that had cancer, which is very difficult, and really started to learn that although these skills are teachable, although we know a lot about the science of how to help kids manage, and not just kids, parents too, because if anyone is a parent, they know when your child suffers, you also suffer equally, maybe more, actually,
Exactly.
right? So I started thinking about how do we support kids and parents together, and realized that there is just not enough resource out there to help with the symptom management, and it's because it's not well understood, it's not integrated into our healthcare system in a way that makes it accessible. And so that's how I got here. I was like, we got to do something about this.
But it's because you felt it
I felt it.
in your childhood. You knew,
I knew. I felt it in my childhood.
like in your body, not in your brain.
That's right. Both. They are connected. That is the thing. You feel it throughout. And pain is fascinating because, first of all, many conditions are, many health-related issues are connected to pain. You can have an injury and have long-lasting pain. You could have a surgery and have long-lasting pain. You could have a virus that triggers long-lasting pain. There's so many things that can trigger pain. So it's a very universal kind of thing, which for a long time, there was no pain, especially in pediatrics, no pain specialty. It didn't really start until the 1980s, which is fascinating because it's a new field, and yet it's such a massive problem. In 2010 is when the World Health Organization first came out with a proclamation, essentially, that said, effective management of pain is a human right. And in pediatrics, we have to understand that in pediatrics and adults, actually, pain is always a combination of your biology, your psychology, which is your thoughts and emotions and feelings, and your social context, who you're with, how you think about it, your culture, all of it matters when it comes to pain. It's very different than, say, diabetes, which is a biomedical problem. You know, you get the medications that you need for diabetes, you're good. When pain is chronic, it is not. the same.
Yeah, we're so connected because this morning at 4 a.m., since I have a journey tomorrow, I was thinking about this interview and I said, I just have one question, and it's, what's pain?
Okay.
Just try to describe.
Yes.
Because like physical pain
Yes.
is so easy to feel. No, not easy to feel, but to know you're feeling it.
Sure.
And then to try to explain it, and then most of the time there's an explanation for that. So they'll say, yeah, it's your knee, I see it here, and let's
Of course.
do something about it. But then emotional pain, and you've just said social pain.
Yeah.
It feels
social
very
context,
deep and you don't
yes.
see it. There's no scan for that.
That's right, absolutely. So let me try to explain, let me back up, try to give you some explanation of how we think about this and how we approach it. Let me start with the definition of chronic pain. Chronic pain is simply any pain that has persisted for more than 3 months. Okay? Chronic does not mean permanent. And that's a very important thing for people to understand, because if they get a diagnosis, oh, this is chronic pain, some people think, this is it for me, I'm stuck with this for life. That is not true. It's a descriptive term only. It means your pain has lasted at least 3 months. So by the time 3 months has passed, or 3 to 6 months has passed, if you've had an injury, your body is pretty well healed. The bones, the joints, the tendons, right? We know that those get better. And that's why sometimes a doctor, let's say you injured your knee, as you said, and they have a scan and they say, oh yes, we can see, we're gonna fix this. And then you go back and you do maybe you do some physical therapy, maybe you take some medications early on to help with the pain. But 5 months later, they scan your knee and they say, it looks good now, you healed well. And you say, no, but it still hurts. How is that possible? And they say, well, I don't know. I don't have an answer for that. Then that's very concerning, right?
Yeah.
When pain becomes chronic like that, when it goes on longer than the body needs to heal or recover, that's when we want to think about mobilizing some other kinds of interventions. But even so, that knee injury, let's say you twist your knee, that's what we call acute pain. It's just in the moment, hasn't become chronic yet. But it doesn't matter, whether acute or chronic, you have a biological response to pain. You have an emotional response to pain. And all of that fits within your social context. And so what I mean by that is the biological could be the injury or a genetic factor that predisposes, whatever it might be. The psychology of it is really complex. Can I take a minute to explain that?
Of course.
Okay. So here's how pain works in the body. And I want to explain the science a little bit, because this is an aha moment for many people. Once they understand the biophysiology of how pain works, it makes perfect sense why we use tools that come from psychology to treat pain, even though I will never say that pain is just a psychological problem. It is biological, psychological, and social all of the time. But
even if it's not an injury,
give me an example.
like a kid that's being bullied.
So that's a very different kind of pain. That I would say, if the kid that's being bullied develops stomach aches and doesn't want to go to school, and you could say, well, stress might have been a trigger. But why they feel it in their stomach, we don't know exactly. It could be that there's a history in the family of stomach aches or stomach pains, or maybe they've seen somebody else with stomach pains. Hard to know, but our bellies, we have a lot of nerves in our gut, in our belly. And so when we feel things emotionally, it's very connected. You know, people say, oh, I have a gut feeling about something, or butterflies in my stomach. It's because of all the nerves that are connected, brain and stomach. Okay. If they're feeling that pain physically, then we say, okay, the pain is real. I don't think kids imagine their pain. I don't think they're faking it. And that's very important. The pain, the symptoms they feel physically are real. Full stop. But Could the stress of the bullying be exacerbating that? Of course. Could their fear of going to school or their desire to not go to school because that's where the bully is be contributing? Of course that's true. And we have to address that. You're absolutely right. But we're talking really about pain that kids feel physically, and sometimes it's tied to emotional pain too. So trauma, we know, is very connected to physical pain that you feel in your body. But so can stress, things like that can be a big trigger as well.
Okay.
Yeah. Okay, back for a second to
Yes.
the science. Sorry, I got off track a minute, but I wanted to clarify that.
Mm-hmm.
So let's imagine you have a backache. Okay. There are little nerves in your back that will send a chemical message up to your brain that says, something could be happening here. I don't know what's going on, but something's not right. Sends this message up to your brain. And there are some parts of our brain that are very specialized, do only one thing. Let's say vision. You have one part of your brain and all it does is help you see. It's the vision part of your brain. Pain is not like that. Pain has what we call, I'm going to give you a fancy term, a neuromatrix. And all that means is that there are very different parts of the brain that are connected to our experience of pain. So this chemical message that goes to the brain is interpreted by the emotion centers of the brain, because pain is our protective response. Everybody is supposed to be fearful of pain so that you take care of yourself, right? We need it for survival.
But enough for you to stop and do something about it.
Exactly that.
Okay.
This is supposed to alert you, oh, you should rest, you shouldn't do something because this hurts, right?
Mm-hmm.
So it goes through the emotion centers of the brain. It triggers our natural fear response for everyone. It also goes to the memory centers of your brain. Has this ever happened to you before? Do you have a memory? Do you know somebody that's had a similar kind of thing happen to them? It goes to the planning centers of the brain. Do you know what to do about this problem? All of these parts of the brain come together, and it's like a mystery for the brain. They take their best guess at what they think is going on. They send a signal back down through your spinal cord to the place where this chemical message started. That is what we experience as pain. And I share this because our physical pain never comes from the bones or the tissues or the tendons in the body. It is produced by the brain all the time.
Wow.
I know. Without your brain, you wouldn't feel pain, right? And here's a good example. Have you ever heard of somebody that's had a phantom limb? Have you ever heard of that before? Yeah, so phantom limb has to do with, let's say you needed to have an amputation in your leg below the knee. Many people, a high percentage, and I apologize, but I can't remember what it is now, 70% maybe, after the amputation will say, I feel pain in my foot. And you say, well, you don't, it's not there anymore. How? It's because our brain is still producing the pain in the foot. You don't even need the foot to feel it, right? So all of the time is coming from our brain. And that means that we can use brain-based skills and tools and strategies to change our response to pain.
All right, so yeah.
It's a lot, I know, but I think understanding the science helps you understand why we say we don't use tools from psychology because we think this is in your head, or we think this is just a psychological problem, but because of how pain is processed, we can use these tools from psychology to wind down or help the nervous system to reset so that it stops sending these messages. By the time pain has persisted and become chronic in that classification, more than 3 months, we say it's usually not protective. It's kind of like a glitch in your nervous system. It's like a smoke alarm that's going off, warning you of danger when there is no fire. And so the way to help kids with that, and people in general, is to help them turn off the alarm. And we can do that. We know how to help people do that, but it's not going to be just a pill.
Okay, before we go to that, then if my back is okay,
Yes.
they see the scan and everything is
Yes.
back on track. I'm still hurting, then we go to the brain.
Yes.
And whatever you do in the back, if they decide to do something else, won't help the pain because the pain is not there.
Good question. It's never so black and white.
Okay.
What I tell kids, the way I explain it to families often is I say, if you've got chronic pain, think of yourself like a tricycle with 3 flat tires. And in order to get you going again, we need to fill all of the tires. Not if you fill one tire, let's say you try a pill or you have an intervention, you only fill one tire. Oh, so one tire is medical intervention, one tire is psychology intervention, and one tire is physical activity, structured physical activity. Could be yoga, could be daily physical therapy with a physical therapist, could be some sort of exercise, whatever it is, we always need physical activity as part of the plan too. And if you only fill one tire, say you just have a medicine, but your other 2 tires are flat, you don't go anywhere, right? You're kind of stuck still. But what we know is that when we fill all the tires together, and research is clear about this, but filling the biomedical tire, the psychology tire, and the physical activity tire together gets you back on the road. So I would not say, oh, we exhaust all of our medical interventions and then we're done and we only go to psychology. It's not how we approach it. We want to do it all together so that we have this really good effect and we help people get moving forward again.
Okay, so let's go to the how. And how open is the medical world to do something different from what we've been doing like the last century?
Yeah. I love that question so much because, you know, as a pediatric psychologist, which, by the way, I'll just explain for a second that in the States, pediatric psychologists are doctors that work, psychology doctors that work in medical settings, right? So we're often embedded in multidisciplinary clinics with physicians and physical therapists and occupational therapists. We are often working as consultants on medical teams, helping to quarterback, you know, helping to guide the treatment of kids and parents. And so because of that, I work a lot with medical colleagues. I work a lot with physicians and residents and fellows. I do a lot of teaching, a lot of teaching in my work. Let me say this, I'll be optimistic first.
Okay.
We're getting better.
Ah, that's beautiful.
However, historically, pain was thought of only from the biomedical perspective.
It was misunderstood,
It was
maybe.
very misunderstood. And that means that physicians, here's what would happen. And it sometimes still happens, of course. But you see a specialist, let's say you've got headaches and you go see a neurologist. And they scan your brain and they check you out and they might try some medications and you don't feel better. And they say, that's my bag of tricks. I don't know what else to say. I'm going to refer you to somebody else. We're going to go see another specialist. You're going to go, whatever, and on you go, second opinions or more physicians. But all the while that's unfolding, people are suffering, right? That journey going from one specialist to another specialist to another specialist without relief is exhausting. And when you don't have relief, you start to feel hopeless.
Yes.
You feel helpless. You don't know what to do. And it can interfere with your sleeping. It can interfere with your work or school. It can interfere with your social life. And then your world gets very small.
Yeah, with your wanting to live.
Of course, exactly. Your whole will to live can change. So when we only approach it from that biomedical perspective, we lose the opportunity to really help people heal and get better and recover. So I will say that although historically there was this very singular view of pain, I think over the last 10 years in particular, I see a lot of change. I feel hopeful, but it's slow.
Okay.
And I would say it's still very common for people to meet with physicians that don't understand chronic pain.
Wow.
Right. They really don't.
Okay.
And they might say, well, if it's not easy to fix with a pill, you need to go see a psychologist. And that breaks my heart. The way that they, not to see a psychologist, because of course I think that's,
the way it's said.
but the way it's said,
Yes.
the language that is used, and the implication that this is somehow your pain is not real.
Mm.
The invalidation around that is very hard for kids and for parents, right?
Yeah.
So we do a lot of teaching about how you talk about this and why the language you use matters so much. And what we've learned is that talking to families, that physician explanation to them is intervention.
Mm-hmm.
That is one of the first steps. And if we can get good at helping families to understand, oh, there might be a role for medication here, but your symptoms have gone on for a long time and they've disrupted your life in many different kinds of ways, we're going to need to use what we call a multidisciplinary approach to really get you back on track.
That's why the hashtag I see you is so powerful. It's just saying like, yeah, I see your pain. You're not making it up for me. You're not like wanting attention. I know. I don't feel it, but I see you.
Of course.
Paining, is that a verb? It should be.
Is
Paining.
Paining?
Feeling pain.
I see that. I'm going to adopt that. I see your pain. I believe you.
Mm-hmm.
Can I just share a quick story?
Of course.
Yeah. So the program I run is called the Comfort Ability Program.
Comfort. Okay.
Ability.
Uh-huh.
And I started this program about 15 years ago at Boston Children's, and it was really designed to fill this gap in our healthcare system, which is to say, we need a way to help treat pediatric pain without the stigma of oh, you need to see psychology. We don't have a solution for you. Off you go to somebody else. This must be in your head. And so you'll notice the name of the program, the Comfort Ability. It's about building the skills for comfort. And we don't think of this. This is not just, well, the pain is going to be here forever, so you might as well learn how to live with it. That is not it at all. Please, I'm not on board with that. We want to teach kids and parents the skills that come from science that help kids to recover. But we're very careful with the language. So this is a program for pain and chronic symptoms. By chronic symptoms, I just want to share that in addition to pain, in addition to feeling stomach aches or headaches or joint pain or nerve pain, kids also present with chronic symptoms, sometimes like nausea or dizziness or chronic fatigue. And from the skills and tools that we use, they apply across the board. So we sometimes don't just say chronic pain, we talk chronic symptoms. And what we're talking about are these symptoms that kind of all hang together. So kids will, and sometimes it's very common for kids to have many of these symptoms together. I have headaches and nausea. I feel exhausted and dizzy all the time. That's a very common presentation. So, oops. So what I was going to say is that the intervention itself is done. You are my best friend.
Yes, he wants to be with you the whole time.
We do it as a group. We invite about 10 families at a time, and it's an all-day workshop. They come at 10 o'clock in the morning. They're with us till 5 o'clock at the end of the day. The kids are in one group, and the caregivers and parents are in another group. And it's a crash course in how do we help kids to recover from their chronic symptoms. It's a lot about the science of pain, because if kids and families really understand the science, then it makes sense why these interventions work so beautifully. It is about social support. Remember I mentioned the social context of pain? If you feel like you're all alone and you're the only one suffering, exhausting and emotionally draining. But when you put people in a room together and they look around and they say, oh my gosh, you get it, and you get it, and you understand it, and you understand it, it's really powerful. We start the day by saying, you're all here because we know your journey has been long, and we know you have been suffering, and we know how hard this has been. And you might not all hurt in the same place. The person you're sitting next to might have pain somewhere else in their body. Doesn't matter. It's affecting their life in very much the same way. And they're feeling a lot of the same feelings about it. And we say, we believe you. We know you're here. We know your pain is real. And just tears.
Wow.
Just parents and kids just start crying because they have not ever sat in a room where they have felt seen,
wow,
where it has felt validating, and that swings the door wide open, right? Because then we say, we're here for you. We are bringing our evidence-based skills and tools. We know we can partner with you on this journey and that there is hope.
So recovery starts there.
It does.
Because
It
before
does.
that, they were like trying to make their point.
Yes.
And this day, they can relax and say, yeah, this is real.
Mm-hmm.
And there's someone here with me.
Exactly.
Mm-hmm.
And the day is remarkable because sometimes kids show up and they're teenagers, right? They don't want to be there. We see kids 10 to 17, so they're sitting arms crossed, they have their hoodies up, you know. They're like, this is not going to work. Nothing's worked, right? They come, they're so hopeless.
One more day.
One day, I know, another appointment, you know. And so they're feeling, and they're so stuck, and they're just exhausted by it all. But they come, and we say, we appreciate your being here. And we invite, very importantly, both parents, if it's a two-parent home, because mothers need to hear it, fathers need to hear it, and other caregivers sometimes too, grandparents, aunties, you know, anybody that's really connected and doing caring for the child, we want them to be present. And sometimes they come, arms crossed, kind of, I'm not sure about this. I came because I was told I needed to, or, you know, referred, but they're not sure. By the end of a single day, they are chatting, they are open, they are smiling, they feel hopeful, they, you know, they get a workbook in the program and they work to learn the skills and the tools, and at the end of the day, everybody makes an individual plan specific to their child about how they're going to manage symptoms. So they leave with a roadmap, they leave knowing sort of what they can do starting tomorrow to really help to turn this around. And we don't give false hope. It's not that one day cures everything, but for many patients, it is the start of a different kind of journey, and it's really moving. It's really beautiful.
I've been reading a book about archetypes, and they speak about the Tin Man of the Wizard of Oz archetype, and we don't get there like from one day to the other. You get to be the Tin Man, who is the one that doesn't want to feel anything, so closed after trying so many things, and then one day it's like, I don't want to try anything else. So you have many tin men sitting there.
It's all tin men, you know, tin people, maybe. But and you have to meet them where they are. You have to acknowledge all of this. You have to acknowledge the pain and the suffering, and you have to acknowledge that parents have done everything that they can think possible, because parents will do anything to help anything, right? You're a parent, I'm a parent. I know what that is like. You know, when my own kids have been sick, you turn into what we call in the States a mama bear.
Yes, a mama hen we call here.
Mama hen, right? Where you are like, don't mess with me. I will get the best care for my child. I will leave nothing unturned, right? So these parents, they are tough. They have worked so hard, sometimes for years, to try to get the best care for their children. And then they often say, I wish I'd known this sooner. If I'd understood what you're teaching us today in a really comprehensive way, I might have made some other choices. And we say, let go of that guilt. There is no guilt, because everything that parents do is in the best interest of their child and in trying to help them alleviate their suffering. Here's the other thing about chronic pain. It is not intuitive. In other words, because pain is designed to be protective, it wants you to shut down. And the important thing that we share with parents, and this is why we separate kids and parents or caregivers, because what we need to teach kids is different from what we need to teach the parents. And I want to talk about what we teach the kids, because I think it's very aligned with much of the work that you do. And in the parenting group, we teach them, as I said, all of the science so they can really understand their kids' symptoms. And then they're just sort of like, okay, now what? And then we have to teach them a new set of parenting tools, because it's not intuitive how to parent these kids. And let me give you an example. So when something hurts, let's say back pain, you feel like you shouldn't move, that you'll make it worse. But remember I said that it hurts, but it's not harmful, which means you're not going to further injure yourself by moving it. And in fact, movement is part of how the body heals. And it's backwards, because your back needs to start moving, your body needs to move a little bit at a time. And through that movement, it learns that it's safe and that it's okay, and that it can dial back these pain signals that it's been sending, because you don't need that protection anymore, right? So that completely flips how we think about pain. And you can do that only when you've seen a doctor and they've said, yes, that your body is fine, it is safe to move. And then we say, great, we will help you with the plan to start moving little by little. We don't, if you were training for a marathon, you wouldn't try to go out and run a full marathon on your first day of training. You would say, today, I'm going to run for 5 minutes. And then I might run for 7 and 10, and you might increase like that. And this is what we do across the board. We call it scaffolding, where we meet kids where they are and we think about what's that first next step. And we want that first next step to be a slam dunk. We would say we want it to be a sure thing for kids, that they say, well, I can't run for an hour, but I could run for 3 minutes, or I could walk for 3 minutes, or stand for 3 minutes, whatever it might be. We say, how about this? Are you pretty confident you could do this? And they're like, yeah, but that's not going to get me. That's not what I want to get back to the soccer team. I don't want to stand for 3 minutes or run for 3 minutes. Yes, I know, we will get you there, but we have to build back slowly. So we partner with them on that. So we have to teach parents things like, when you ask your child about their symptoms, it can make it worse, which seems completely wild, right? But let me explain neurobiologically what happens. If kids are distracted, maybe they're talking to a friend or, out at a concert, doing something fun that they enjoy. And then somebody says, how are you feeling? Are you okay?
Remember.
Remember, the memory centers of their brain comes back and they say, oh, no, I still hurt, and now it's front and center. So parents wanting to be helpful often will ask their kids many times a day about their symptoms. They'll wake up, how do you feel today? After you've had breakfast, how are you feeling now? Do you think you can go to school? Do you think you can go to your activities? At bedtime, are you going to be able to sleep tonight? How do you feel? And all of that asking and checking, which is very well intended, has the opposite effect. It just keeps these symptoms front and center. So we say, don't ask. If your child would like to tell you how they feel, of course they can. But we tell parents, you must tell your kids. If you've been asking a lot about their symptoms, you have to say, you know what? I learned something important today. Asking about your symptoms isn't helpful. So I'm going to stop doing it. If you would like to tell me how you feel, I will always listen to you. I'm just not going to keep asking, because that's going to ping you to think about it.
To be very Joe Dispenza style, it keeps the neurons wired.
Yes, exactly that, precisely.
Wow. So we're trying to make them remember that they wired together and that they can go and do something else.
Right, exactly.
That is better for the whole body.
Again, and now it's just part of what we teach, right? Like there's so many components to it, but things like that are not intuitive for parents.
No,
And they have these
course not.
aha moments where they're like, oh my gosh, I've been asking all the time about pain. So now, yeah, I need to change that up a little bit. So we partner with them to teach them the skills and the tools to build plans to help things like sleep, to help things like daily activity, to help with school, either doing homework or in the States, school attendance is a big problem when kids are really struggling with their symptoms. So making what we call a transition plan to slowly go back to school. And we partner with schools who are very open. They want to help kids, they want to support them, but they don't know what to do either. So we have to provide education to the schools for how to support kids in the school setting.
We need to change the whole system.
just a small
yeah,
aspect, but yeah, we can. But the other thing that's really important and that we spend a lot of time teaching kids are what we call relaxation response skills. Because again, if you understand that pain, chronic pain, is an alarm that's going off in the brain, we call it wind up in the brain, and we need to teach them skills, brain-body skills, that can help the whole nervous system to wind back down. That helps with the triggers of stress. That helps also with the experience, the severity and the frequency of the pain itself. And so we do things like, they come to the workshop, we have yoga mats, they stretch out. We do diaphragmatic breathing or deep breathing exercises. We teach them many different kinds. We do guided imagery. We do mindfulness training. We teach them skills around biofeedback, which is really cool for teenagers because, are you familiar with biofeedback?
Yeah.
I'll just explain it briefly, but biofeedback is a way of seeing the nervous system live. Exactly. You see it on a computer screen. We use sensors that pick up your heart rate, and your heart rate is controlled by your breath. So when you breathe in, your heart rate goes up, and when you exhale, it goes down. And we can see these really beautiful up and down curves of the breath. So when you engage in diaphragmatic breathing, you slow your heart rate, you relax your muscles, you calm your mind and your thoughts. It's really beautiful. And sometimes kids are like, I don't know if I'm doing it right. I don't know if this is having the effect. So if you hook them up to a computer and they do biofeedback and they can see it live, the difference that it makes, they're like, wow.
Real life body Nintendo.
Exactly. It's exactly what it is. Like gamification of the relaxation. Exactly that.
So it's basically a parasympathetic nervous system training?
Yes, exactly that. Because the pain triggers the sympathetic nervous system. It lights it all up. And we need to make them experts in triggering the parasympathetic response to wind down the whole nervous system. And again, we've provided education for them so they understand that this isn't just saying, oh, you're nervous or you're anxious, that's why you need this. It's really about changing the body's response to these, to the signals themselves. In fact, we do one guided imagery that is specific to changing the way you think about your pain. So we have kids imagine, what is the shape of the pain? How big is the pain? What's the color of the pain? And we bring them into the control centers of the brain. We use guided imagery and a little bit of self-hypnosis in it as well. And through the exercise, they're asked to soften the corners, to shrink the size, to lighten the color. And we guide them through this exercise and we have them draw the before and after. And it's really fascinating to see because before it might be red, spiky, big, blob is sort of how they visualize their pain. And at the end, it's kind of transparent and soft corners and a light pink. And it's like if you can use your brain to change these images and to change the threat response that you feel in your brain, your parasympathetic system will help you to reset. And that's a big part of the recovery.
But that's such a beautiful training for life. I think about these
100%.
kids being adults
I know.
and having stress at their jobs.
I know.
They're gonna say I've been here.
Yes, so to your point exactly, we have a peer board, an advisory board, and a parent or caregiver advisory board. And we have this is just a remarkable group of teenagers, aged like 14 to 25 to young adults too, who've been through the program, and they're on the other side. You know, they're in college, they're doing beautifully, and they stay connected to our program. They serve as peer mentors, and they do guest speaking at our workshops where they share their own lived experience, and because it's one thing for kids to hear it from professionals, it's another to hear it from a peer. And so they'll come into the workshop and they'll say, if you're doubtful, I was there. Wow. I know what you're going through. I also didn't think any of this would work. And not only was this an essential part of my recovery, but I still use it when I have exams in school, if I'm nervous for a job interview, if I'm just having a really rotten day. This is how I reset. I still use my breathing techniques. I still use my relaxation techniques. And I'm so glad I learned them. And they will say, I never would wish this journey on anybody, but in some ways I'm better for it. I feel very prepared for life. I've learned so much about how our thoughts affect how we feel emotionally and physically, and that there's something I can do about it. I control what I think, so I control what I feel. And, you know, to some extent, I can help my body to relax and reset. And it's so powerful, so powerful.
Yeah, it's a superpower.
It's a superpower, yeah.
And I'm thinking because our world is changing so fast,
Yes.
and I think for good, especially in these cases that are with kids, family come, parents not knowing this,
Yes.
so they have to learn it from the beginning.
They do.
Without feeling the pain,
Yeah.
just by compassion and
Yes.
love.
Yes.
But then the whole family, if they're engaged, they'll get a superpower and they'll do a big upgrade in their lives.
I agree with that 1,000%. Some of the tools and parenting skills. So, for example, one of the parenting skills that we teach is called reflective listening. It's a communication strategy for kids and parents. And it's very structured. And we go through the steps and we say, lots of times, there are two things that can happen in the parent-child relationship when this journey has been long, which it often is. One is there can be quite a lot of conflict in the family. You can have parents that say, toughen up, enough is enough. You need to do all of your things. And they feel, and the kid says, I can't. And they said, you must. I can't, you must. You know, they just butt heads, and it gets very tense and explosive. And that stress goes back to amplify the pain and the symptoms, right? Because we're all connected. The other thing that can happen is that one parent might say, oh, you poor thing, let me help you do this, you don't have to do that, and is really overly protective and providing too much love and care. And I don't want to say don't provide love and care. I love and care on my kids all the time, as parents should. But some of these helping behaviors over a long period of time can exacerbate symptoms, can make kids feel like, oh, well, if I'm not expected to, do what my brothers and sisters do, if the rules are different for me, I must be really sick. And that then goes and amplifies the pain cycle too, right? So those things can happen. So what we want to teach parents is a really effective way to validate their child's experience, physically and emotionally, and then to do some structured problem solving with them about how we're going to move this forward. We want to move away from the overprotectiveness, and we want to move away from the just toughen up,
Because even chronic pain can be so acute.
Yes.
That we feel, because pain is very, it takes everything in your life. Everything, you breathe pain. So you never see the way out of it.
Of course.
So the family might think, let's do everything now. Like we can earn all our energetic savings.
Yes.
And then we'll be exhausted.
Exhausted. I know.
So sometimes moms are like that because we think we have to do something about it now.
Exactly. And I feel that. I know that. I understand that and appreciate it, and it's valid. But you're right, it's very expensive to get this care and this treatment. And if they're in the home setting, sometimes you have two caregivers that think very differently about the problem, and that can cause stress and tension too. Maybe mom thinks about it one way and dad thinks about it another way, and it can cause a lot of conflict in the family. So we want to get parents on the same page. We want to have them both understand the problem and align in their approach, and then teach them how to bring their kids through. And so we teach this communication skill, and parents say all the time, oh my gosh, I will use this on all my children, not just my child with pain, but this is such a beautiful way to connect and be present, to validate their experience. But that doesn't mean, there are no rules for this child. It doesn't mean that we stop trying. And so we want them to be partners together as much as possible.
Because I've seen, I bet you too, many, especially mothers, because we have this overcaring in our cells for our kids, that after the pain goes, after the sickness is gone, then they get sick.
Yeah, that's an excellent point too. Sometimes chronic pain can be genetic. And what I mean by that is that there are some biologic vulnerability factors. So sometimes there is a parent or somebody else in the family that has chronic symptoms and the kids look very similar. One of the beautiful things about working with children is that they have neuroplasticity in their brain. And all that means is that because their brains are growing rapidly, they're creating new pathways in the brain all the time. All of the growth and development that happens, right? We know childhood is just an explosion of growth and development and learning, and their brains are learning machines. So we capitalize that on the recovery from chronic pain. If we can get in early and rewire how they're experiencing these symptoms, often they go on to not have any episodes. They reset, their whole nervous system rewires. And if they have another episode of pain, they can fix it much more quickly because they've already built that wiring in their brain. Adults also can recover, but kind of like if you were an adult learning a new language, it's harder than if you're a child learning a new language. It takes longer. That path, that road can be slower. And so sometimes parents feel, well, I've been suffering for a long time. I've tried these things. They didn't work for me, and might be dismissive. And to them, we have to explain that kids are different, and we really have to think about rewiring that and not just say, well, if this was your experience, this will also be your child's experience. And so we want everyone to sort of move forward.
Do you know what I love about this, the whole system you're explaining, is that you think that your patient is smart enough to take care of themselves, and you explain the whole thing. You're just not saying, take this, take that, go to sleep. You're saying you understand even the biology, even the medical part, even the hard parts that are for students. But since you're here, you're a student.
Yes, that's exactly right. I do believe that patients, they want desperately to understand. They don't just want a pill and off you go. They want to understand. There's an interest, like people are dialed in, right? They're really engaged with the program. And I do believe that they can do it. I will say this, we do often partner with families after they do the program. So we invite them back for a visit 2 weeks later or a month later, and we say, where are you in your plan? How is this going? Where have you hit roadblocks? How do we get over them? That bounciness. How do we partner with you? Because I don't expect that they can do everything on their own. So we do some follow-up care, and I think that's an important piece of it. But now they're oriented. Now they understand the frame. Now they see, they've got the hopefulness, they've got the roadmap. So even if they hit a barrier, we're just working on that barrier, and then off they go. So we stay very focused on helping them identify what their specific plans are, whether it's sleep or whether it's learning the relaxation skills or increasing function, school or activity. We want to know, how far along have you gotten? Where can we partner with you to keep you moving on this path.
Pain can be remembered like as a memory, but not refelt. I don't know how to say that.
Like you experience.
Yeah, like I try to remember when I gave birth, and I remember, oh, it was hard, but I'm just saying it. I'm not remembering with my body.
Right.
Just words,
Yes,
right?
Yes.
So we cannot feel in advance maybe a future pain, but is there a way that we can train our brains and ourselves for future pain?
Yes, absolutely. I do this. I started teaching my children when they were very young how to do breathing and relaxation kinds of strategies. And I do think that you can prepare for it. I do think if you learn and you understand, you have to understand two things. One is you have to be able to identify your thoughts around the issue.
So become an observer.
Exactly that. You have to observe, oh, am I thinking this is going to hurt a lot? Or am I expecting this is going to be terrible? So you have to be able to observe those thoughts and put them in context. And then you have to be able to say, oh, my heart is racing and my muscles are so tense because I'm worried about the pain, or something is feeling painful. And you have to be able to do the opposite. You have to trigger that parasympathetic response, relax the muscles, slow the breath rate. All of those tools and skills help the body to reset. So I absolutely think you can teach these skills even without pain. It's harder to do when you're in pain every day, actually. And in fact, I think there's great benefit in kids learning and feeling masterful with these skills before they even experience things.
Even for relationships.
Yeah, of course. But even things like vaccinations. Sometimes kids don't want to do their vaccinations because they're worried the poke will hurt. We have beautiful resources to teach kids how to do these relaxation skills and then there are also, topical things that you can use sometimes to reduce the experience of a needle pain as well. But those things can absolutely help to improve the quality of life.
But there's something tricky, like as a yoga teacher, even as a yoga teacher, I'm very mental. I live in my brain, I think a lot, and I process reality through theory. And then I'm a very slow processor in my body. Like, it takes time for me. Like, I would like it to be quicker. And then I know the mind is quick, but the body is so slow for everything.
I know.
So sometimes, like, to interlace this with the previous question, I've been wanting to learn a lot about life and how it evolves. Like a strategy maybe for it not to hurt in the future, but then pain, especially emotional pain for me, come and it hurts, and then I get frustrated because I say I was so prepared, and why does it hurt? But it doesn't work like that. I mean, it's a preparation, but it's not a strategy. It won't make you not feel pain. It will help you to deal with pain.
Yes, exactly that. I think, and I understand exactly what you're talking about. We can only sturdy ourselves up so much, right? There are things that will hurt. There is pain that we will experience. Some of what we teach a little bit comes from the work of acceptance and commitment therapy. I don't know if you're familiar with that at all, but there's a concept in there that I think is really important for kids to understand, for everybody in life to understand, called distress tolerance. And basically what that means is I'm uncomfortable in this moment and I can be okay with that. I don't have to react to it. I don't have to judge myself around it. I can be present and I can experience something that I know is uncomfortable and I can manage it.
How do you train yourself for that?
So it's very much through this mind-body work, or this brain-body work that we do. And we have kids acknowledge that you might experience this pain. It might be present, but this is just a bad moment or a bad day. It doesn't mean tomorrow will be the same. And you are equipped, you are capable of managing this. So where we get distress intolerance comes from fear. I can't manage this. I don't have a plan. This will go on forever. I'm not good enough at doing what I need to do to make this go away. And we don't expect that kids will, or anybody can fully make their symptoms go away just with the use of psychological tools. But if you can build in that acceptance and that distress tolerance for now, again, realizing this won't be forever, that is our hope for everybody, then it's much easier to be kind to yourself, to have grace around what's happening, and you don't feel like I have to do something right now, I have to react to what's happening, because that reaction winds up the nervous system again.
Mm-hmm. So this is like a stop sign and live with it and breathe through it. It sounds so much like yoga.
Yeah, so much.
Yeah,
so
because
much.
you're in Warrior 2 and you're not enjoying it.
Exactly.
Not even after 20 years of practicing.
Yoga is beautiful training for distress tolerance.
Yeah.
I know, I also practice, and I really feel like so much of the language that's used around that inspires growth and builds the muscle of distress tolerance.
Exactly, and people from outside come and say, it looks so graceful, and you inside, you're burning.
Right.
And I say it's not like the shape of a warrior, it's the brain of a warrior, because it's very uncomfortable, very, but you learn to be with it.
Yes.
And you don't suffer it.
Right, exactly.
At the end, you're just like, oh, this is so beautiful.
Yes, and at the end of the practice, there's so much benefit, right? And so that's similar frame that we're using here. If you can really, really learn and engage with these skills and tools, if you can be open to integrating them into your care, it's not one thing or another thing, it's part of the overall treatment, then your journey is much easier long term.
What would you say to a mom or a dad that is suffering pain? Well, not mom or dad, an adult who is, but especially to a mom or dad who have a child suffering pain or in the middle of this kind of diagnosis that comes and goes, that's so hard because after 6 months you go again and maybe it's there again, or maybe you're okay, but then you're never fully relaxed because your life is just going around sickness and doctors and hospitals. What would you tell them?
I would say, let me say this, when parents come to see me and they only get referred to our pain clinic when their journey has been long. So I know by the time they're in my office, their child has been suffering for a long time. Many months at least, sometimes many years. And I say, first of all, I'm really glad you're here. This is where you need to be. And I work again within a team that is a physician and a physical therapist, and we're very careful about the language we use, and we work in an integrated way where and that really helps because they feel like, oh, this isn't separate from treating the medicine I'm getting. This is a package. This is part of how we recover, and you're specialists in this, so we put our trust in you. So I say, I'm glad you're here. There's a lot that we can do to help you on this journey, but you have to be open to it. You have to be willing to rethink some of the things that you've been doing and feeling and saying, and some of the many doctor's visits that you've been going to. We have enough data now from our physicians. We know that your child is not in danger. We know that. We also know that there is not a pill or a single solution to helping your child feel better, because if there was, you would have it already. And so we say, now we're going to think of your child as a whole person, and we're going to think about the family and the caregivers together, and we're going to try some new approaches, because if nothing changes, if you keep doing what you're doing, your child will continue to suffer, and life will feel small, and you'll have, you'll just keep going around in circles. We need to completely shift and go in a new direction, and we can only do that in partnership with you. So we want to join with them and then, teach them all of these new skills. What's tricky for parents sometimes is that their physicians might not have this training. Pain physicians going through our medical system get like a couple days of pain training. They don't get enough education. And like I said, I think it's changing. I think we're doing better, but it's slow. So many of the physicians that are out there in the field don't really understand the biological, psychological, and social factors that are all part of pain all the time for everyone. So because of that, they might just say, oh, go see another doctor. So to some extent, we need parents to own that this is what my child has and make some choices about how they're going to treat it within their family, and not just continue to see doctors.
Okay. I believe this is not your area, but it has everything to do with you. So, like before today, I would think that somebody going to your office would be because there's nothing else to do, they're dying, and they just need pain management. So you do the opposite. So so people who's healthy now, like biologically healthy, go there to be treated just for the pain that stays.
Yes, in fact, I don't do the type of pain that's associated with palliative care.
Okay.
So we think of like end-of-life care or chronic conditions that are not going to get better, painful diseases and things like that. I don't do any of that.
Okay.
I only am working with kids who have chronic symptoms, headaches, stomach aches, back pain, muscle pain, achy joints, sometimes just in one area, but sometimes all over their body. Dizziness, nausea, like these kinds of chronic symptoms that may have gotten started. So this is a really interesting point. Sometimes these symptoms start out of the blue. We don't even know why. Could be stressors, could be it could be anything, but parents say no, they just woke up one day and they had this. Sometimes it starts after a trigger, like a sprained ankle, let's say, might turn into chronic leg pain, or a flu might turn into chronic body aches, right? Or COVID, long COVID is a good example of that. So sometimes there are triggers that we understand very well, but what got the problem started is not what is keeping the problem going.
Oh, it matures.
It matures because once it's crossed over and it becomes a chronic symptom, then we say, well, it doesn't matter really what got this started. That's not important anymore. Okay. What's important is how we treat the symptoms, and this is our approach. So I only work with kids that I expect, that it's not, and I don't do any end-of-life care. I don't do any, that's a whole different area of practice. Also, these skills can be very helpful there. That's just not my area of practice right now. But the kids I work with, like you said, they're biologically, before this happened, they were doing great.
Like they have hope because they knew how they were before.
That's right.
And that's their goal.
That's
to
their
go
goal.
Back.
Yes.
With the superpower.
That's right.
Okay. So how do you see the future of pain management in your area?
I feel very hopeful. I think we're doing a better job. My trip here to Medicine has been amazing.
Really?
Oh, I cannot tell you about it?
Of course.
I would love to tell you about it. This has been a dream of ours, from my team. I have an amazing psychologist on my team, Dr. Manuela Villa, who is from Medellin, and she joined my team about 2 years ago. And from the time she got here, she said, "This is so good. We need this. We need this back in my home. We need it in Colombia. We need it in South America." And I said, "Right, okay, let's figure out how do we get there." Because right now the program runs only in North America and Australia. So we run the program at about 50 children's hospitals in the U.S., Canada, and Australia. This is our first partnership. I know, how exciting is this? It is our first partnership in Medellin. And so Dr. Villa connected with this incredible practice here called Growth, which is a practice that really, a psychology practice here. We have incredible neuropsychologists, and they're partnering with us to create a language and a cultural adaptation of the program so that we can bring it here to Medellin and to South America more broadly.
Well, we'll have to be dreaming about having it like a part of insurance and all kids.
Of course.
Yeah, because I don't want these type of things to be like only for certain people.
No. So we've met with the hospitals, we've met with doctors, we've met with medical directors. We have had so many incredible meetings, and which is exactly what this was the partnership that got us here. But we are thinking much bigger. We are laying the groundwork to be able to bring this to children regardless of insurance or their experience in the healthcare system. And so we need to think about the whole context of how the healthcare system works here so we can figure out these important things. But the people that I have met with have been so excited for this. And that tells me something very important, that people are ready, that they recognize, the medical professionals recognize that this is a massive gap in our healthcare system, and that we are unintentionally, that there is harm for these children because they don't have access to these kinds of comprehensive interventions that flip the way we really address these symptoms. And so if we don't figure out how to put a stop to sort of just going from doctor to doctor to doctor to doctor, so without treatment, many of these children will go on to be adults with chronic pain as well, and have long-term disability. And we know that the burden on the healthcare system, all of these doctor visits, like you said, they're expensive, they're time-consuming, they're extremely costly, and they're not the most important. That would all be fine and well if it cured the problem, but it doesn't. And so I just have to say that everyone I have met with in Medellin has been so excited to help us figure out our adaptation so we can start to embed these kinds of resources here in Medellin and beyond.
That's beautiful.
It is, isn't it exciting?
Yeah, I feel hopeful, and I've said that Medellin, maybe because we have such a hard history.
You do.
Maybe because of that, or because, I don't know, we're lucky, there's space for this.
Yes.
Like people want this.
They do. And I think if we can, if we start with these partnerships with all of these medical and psychology and physical therapy professionals, like yesterday we did this, what's called a co-creation workshop, where we all came together, school nurses, physical therapists, physicians, psychologists, neuropsychologists, teachers, educators, everybody, to work on how do we adapt this? How do we make sure culturally it works well here? And what are the gaps in the healthcare system that we can help to fix with these kinds of resources and interventions? And it was amazing. Everybody was so excited about it.
Well, I'm not part of the team, but I can tell you, like, the big gap is the I believe you gap, because like the healthcare system can be collapsed and can be tired, and maybe don't know enough of this. And mothers can also be collapsed. We're also tired. We do also many things. We need to stop, but we don't, and we can't. So you're there in the middle of that thing saying, I believe you. I have something to do about it.
Yes.
You don't need to be collapsing anymore. Let's make some space for this. It's a beautiful in between.
It's exactly my hope, that we can help parents and kids really fundamentally understand it so that they are seeking it out. And we help the medical professionals really understand it so they're making those connections too. It has to happen in both places, right? So we need to do our outreach across the board that way so people understand.
But you don't search for it because you don't know that it exists.
Of course.
So now you have it in the dictionary.
That's right. That's right. Yeah. So the Comfortability program is, it's got a website. It's got lots of resources online.
Tell us about everything and about your book, please.
Okay. So in preparation for our trip here also, we've been working with partners in the U.S. to translate resources so that we could have them readily available. So, I don't know, can you link to things on your...
Yes, of course.
In
the notes.
Oh, perfect. So we'll put up some amazing links. First, I'll tell you about the Comfortability program. The website is just thecomfortability.com. And right now, the resources up there are in English. However, within the next few months, everything will be translated on the website.
As this podcast you'll be an amazing native Spanish
Exactly.
speaking.
I cannot wait to hear that
Yeah.
and see that. Right. So all the resources will soon be translated. That's in progress. But on the website, you can access relaxation exercises like the guided imagery I told you about.
Amazing.
It is up there and free. There are mindfulness exercises up there. You can also hear patient stories. So you can listen to teenagers talking about their journey and how they got to the other side. Parents and caregivers saying, I came here not believing any of this would be helpful. Let me tell you about where we are now. Very, very important education. There are how-to videos, so how to help your child with relaxation skills, how to talk to your child when you're feeling stuck. So there's sort of sample videos, lots of resources all about understanding pain and the how-to of starting to approach this. I also want to tell you about the Meg Foundation, and you can put a link to that website too, because there we already have some education resources in Spanish that I helped to develop along with partners at the Society for Pediatric Psychology, so a national organization of people that are trying to get resources out there. So we'll put the resources for those. What is chronic pain? What is functional impairment? How do you help your child with sleep? Why do we focus on function and getting back to school? All of those things. So those will be readily available. We also, our teams that I was telling you about, our peer advisors, have created their own podcast. It is phenomenal about their journey and about their experience. And
what's the name of the podcast?
the podcast is called Chronic Pain as You've Never Heard It Before.
Wow.
It's on Spotify.
Okay.
And it's only in English right now, but hopefully we can get that translated too. And it's just amazing to hear them tell their story and hear them talk about the skills that they use and how they really transform their lives.
And the book?
The book is called When Your Child Hurts.
Oh, it's so beautiful.
And it's written for parents, and it provides lots of education, lots of neuroscience that's very accessible, and also explains how do you help your child sleep when they hurt? How do you talk to your doctors about your child's symptoms? How do you start to really integrate some of this approach, some of this more, all of the tools from psychology? How do we get those in? So each chapter in the book talks about an area and then has a section called How You Can Help. And it's designed to empower parents, to educate and empower them so that they can really feel sturdy in this journey and feel anchored in understanding what's within their power, what can they do to help their child.
Is it coming in Spanish?
I hope so. I'm working with my publisher now. Right now it's in English, but soon I hope it will be in Spanish as well.
I've been thinking about so many people I know with everything you've been saying and sharing. So I want to say thank you for doing it right in the hope of the future, which is the children of this world.
Of course.
And everything can be so easily adapted to adults. And since, like, I believe in the way I teach that there's like a fountain movement, like when us as parents prepare ourselves and get better and more conscious and more patient and more like making space for life, for emotions to be there, even if it's uncomfortable. When we eat better, sleep better, breathe better, have better relationships, is like obvious they're gonna receive that.
Yes.
So, well, we're not children now, we're not the future of the world, but our children are receiving everything constantly, so we can do it at the same time.
Yeah, I agree.
And it's gonna
be
feeling different.
I know. I will say, like, you know, in our parent workshop that we run, there is space that we protect to talk about how do you care for yourself, because of course if we pour everything out for our children and we leave nothing in the cup for ourselves, we are exhausted and we can't continue to pull all the resources together and to help our child to the best of our ability. So we want parents to think about exactly that. What are you doing in the service of your own wellness, in the service of your own care, to give yourself some grace, to, you know, connect socially, to take care of your own mind and body. And parents also cry at that part of our program because they say, I haven't thought about myself in so long, you know, and we want to give them permission, not only permission, but a prescription to do it, to say, this is as important as everything you're doing for your child, because you all work together as a system. So you need to take care of yourself. The metaphor we often use is that when you're on an airplane, they say, put your own oxygen mask on first before assisting your child. And it's very much that. We need oxygen. We need all the oxygen so that we can be there to support our children. They depend on us.
I don't know where I read this very recently, but it says like, try to be well, because your child is going to need you when he or she is out of this.
Of course.
And it's going to need you healthy and happy.
Right. That's right. That's right. Yeah. Parents' experience is very important, I think, and often overlooked. And there's excellent research to show that when parents take care of themselves, kids do better. That's, I mean, you can't argue with that.
Every time
for health and wellness. So we really double down on that, and we give equal attention to parents as we do to kids in this program, because it's the whole family together that needs to heal. This is really exhausting, and everybody needs new tools and new skills and an open mind and some new approaches to understand that this is intervention for pain. This is not in any way implying that symptoms are psychological. We are just using all of the resources and all of the science to help reset the nervous system.
Thank you so much for that.
You are welcome.
Well, I exit this conversation feeling very empowered.
Oh, I'm so glad.
Yeah, thank you. And I know everyone's gonna enjoy it so much. So thank you for coming to Colombia, to Medellin, to my home, and for sharing everything you have, for sharing your book. I'm gonna be reading, and I'll see you back in Medellin for sure.
I cannot tell you what an honor and a privilege it is to be here, and I so appreciate the opportunity to provide some education. I know your parents and your families that are listening. I hope it's eye-opening and maybe just plants the seed that there's a different path forward here that can be really beautiful.
There it is. Thank you so much.
Thank you so much.
And thank you all for listening. Nos vemos en el próximo Abiertamente, conversaciones con Yoga al Alma. Chao, chao.